Personal protective equipment, PPE, is at the heart of our fight against coronavirus, shielding the doctors and nurses on the front lines who are protecting us all. So reports of widespread PPE shortages are stirring fears, with growing numbers of doctors and nurses infected and even dying. Dr. Nishant Joshi, just coming off his night shift, is now having to work 80-hour weeks to cover for sick colleagues.
We're all filling in for sickness gaps, and it means that our exposure is going to be much higher, and it's going to be with inadequate PPE. So you can take a guess at what's going to happen to people like myself and my colleagues over the next few weeks. The likelihood is that we're going to get more sick more often, and that we're going to face even more critical staff shortages.
Channel 4 News has seen emails from 2 NHS trusts which raise concern over critical PPE shortages as early as this weekend. This internal email from London North West University Healthcare Trust warns that surgical gowns are running critically low. They also say we cannot guarantee when we receive more gowns, so it is important that we make our current stocks last. Similar concerns at the Royal Free Trust. We will no doubt run out of items over the weekend, and so I would ask staff to use stock and consumables sparingly. A spokesperson for the Royal Free London Trust said they were confident that they can continue to maintain the necessary stock levels of PPE to support their staff. And the London North West University Trust say that since the email, they have received delivery of PPE and now have adequate stocks. I raised the concerns of frontline workers at today's press conference. Home Secretary, will you apologise to NHS staff and their families who've told us it's the lack of necessary PPE that's led to preventable mass infections and many deaths?
Well, I think look, absolutely, we are focused as a government across all departments to make sure that everyone in the NHS has everything they need in terms of resources and equipment.
But no apology, Home Secretary.
Well, I'm sorry if people feel that there have been failings. I'll be very, very clear about that. But at the same time, we are in an unprecedented global health pandemic right now. It is inevitable that the demand and the pressures on PPE and the demand for PPE are going to be exponential. They're going to be incredibly high.
The government says they've employed Herculean efforts to get PPE to where it is most needed, delivering millions of items across the UK and even drafting in the army to help. But the British Medical Association has warned that dangerously low levels of PPE are forcing doctors into an impossible situation, having to decide to risk their lives without proper protection. In recent weeks, pictures have been posted of staff wearing makeshift PPE. Nurses in Northwick Park were pictured wearing clinical waste bags as they appealed for proper masks, gowns and gloves. But yesterday, the Health Secretary, Matt Hancock, angered some by seeming to suggest that NHS workers were overusing PPE.
Everyone should use this equipment, use the equipment they clinically need, in line with the guidelines, no more and no less.
To Matt Hancock, I would very politely invite him to one of my night shifts over the next few nights. He's more than welcome to join me on the wards as I'm scouring for PPE sometimes. I would ask him to please bring his own PPE because I don't think we would have enough to share for him.
It's an invitation for the government to fully understand and support frontline staff as they risk their lives to try to save others.
Earlier, I spoke to Dr. Rosanna Allen-Khan, who's Shadow Minister for Mental Health and also an A&E doctor. I began by putting to her the government's claim that they were unaware of any correlation between the deaths of healthcare workers and a lack of personal protective equipment.
Well, I think there has to be some sort of correlation between the numbers of deaths that we've seen and the amount of time it took for proper PPE to reach the front lines. I asked the Prime Minister myself a number of weeks ago, I asked him, where was our prior planning for our frontline staff to have the protective equipment when they needed, considering that we had our first case of COVID-19 here in January. It simply isn't good enough. Staff are feeling underprepared. Their mental health is suffering a great deal. We have people who are having to bury their colleagues because they have gone in to fight to save lives. They simply must be protected.
So when the Health Secretary said today that he suggested that some NHS staff were overusing PPE, does he have a point?
What we do not need in the NHS and for our workforce is for the government to go on a press conference every single day outlining the number of pieces of PPE that have been distributed. We need to have the protection on the front line, and his comments are ill-informed and do nothing to build trust between the government and those who are putting themselves at risk to save lives.
Do you have enough PPE at your hospital in South London?
It took us a number of weeks to get the PPE that we needed. We then got a good amount, and some of that was because local schools had sent us goggles, which was absolutely fantastic. But what is deeply alarming is that this looks like an attempt for the government to shift blame onto hardworking NHS staff when themselves they need to be looking at what they must do in order to protect those that are going into bat every single day to save lives.
Well, the Health Secretary has promised daily deliveries of protective gear. And there is a sense, isn't there, that this is just a huge global crisis, that actually no one could do any better in the eye of this particular storm, no?
Frankly, I feel the response has not been good enough. I am not saying that to score political points, because we have to be working together, cross-party, to make this work at a time of national crisis.
When you've done a shift and you turn the key in your front door, how do you cope with the scale of the deaths that we're now seeing in this country?
I have to call ahead when I finish my shift and ask for my children to be kept away from me until I've managed to have a shower and change my clothes, because there is that palpable fear of spreading the virus to those you love the most. And I also have a father in a care home who I can't go and visit, and he doesn't eat unless my brother or I goes and feeds him. So I worry every day that he thinks we've just abandoned him, completely left him and have forgotten all about him because we can't go and see him and reassure him that we're there and we still love him. It takes a real emotional toll, and losing colleagues who have gone to work to save lives, and honestly believing that some of it could have been prevented if they had had proper PPE from the outset. That's a very, very difficult cross to bear.
Do you think that we may be over the worst now? There's some optimistic noises coming out of those looking at the figures.
We're seeing the death toll go up every single day. Yesterday, we had almost 1,000 in-hospital deaths reported. We don't even know the scale of the issue in care homes at the moment. We won't really know what we're dealing with or be able to fight this successfully until we roll out mass testing. I am deeply, deeply worried about the recommendation that it's okay to go out after 7 days of having the symptoms. I believe we need to be following WHO advice and doing what the rest of the world is doing. I don't believe we have got on top of this. I believe that there is still a long, long way to go.
Dr. Rosanna Alan-Khan, thank you very much. Well, at the Downing Street briefing earlier, police chiefs said forces have seen a 21% drop in overall crime in the last 4 weeks compared to the same period last year. But today, officers were still out in force, making sure people aren't breaching the social distancing rules. Families have been warned not to try visiting popular tourist spots. In East London, Victoria Park reopened today, complete with police patrols and loudspeakers, ordering people to keep their distance or face being moved on or fined. Aisha Tull is there for us tonight. Aisha.
Have people been staying at home? Not from what I've seen in the parks that we've been to, but they have been trying to keep their distance, apart from some sunbathers who were moved on really quickly. Now, today, Victoria Park reopened after being closed for 2 weeks, but one big restriction is it's actually now closed, and that's because at 4 o'clock they closed their doors. But there are also some other restrictions as well. A megaphone telling people what to do. Those were park rangers, police on horseback also moving people along, and people were policing themselves and policing others. We heard people saying, well, you shouldn't cycle there, you shouldn't do that. We also heard some other unpleasant things that people were saying as well. But we spoke to residents about how they feel about the park being reopened.
This is my garden because I live in a flat, and the people that spoiled it for everyone are the people that are playing football and rugby, and I can't understand why the police don't evict those people that are being irresponsible. and let people like myself that are staying socially distant be able to use the park for our mental health.
It's really stressful. There are so many people running up and down, and people that are jogging are completely thoughtless.
But there's been criticism as well. There's been criticism that on the hottest day of the year that this park has reopened, the mayor told us that actually this park is needed for people who are living in tower blocks nearby. And he also said that it's important that they listen to the changes that they've made.
Well, we need people to self-police, basically, but we'll have some park wardens and other people doing a bit of supervision. So people need to maintain their distance. They need to not come here for a barbecue or a drinking party. They need to really just come here, do their bit of exercise and then disappear again.
It's day one, and so most people are respecting those rules in this park for now. But even since we've been here waiting for this live to happen, there have been people jumping over the fences and there are dogs kind of running around in the park, and it's going to rely on the majority of people doing the right thing and also